100%.
Seconds after Candace Nickens gave birth, her son, baby Mayan, is in trouble. He has stopped breathing.
Come on, boy.
Are you getting a heart rate there?
No.
Come on, boy.
Even after the NICU's valiant attempts, baby Mayan still isn't breathing. They put a thin catheter connected to a suction machine down his throat to clear mucus and fluids clogging his airways.
Heart rate's 1 at 100.
Just give it a little bite.
At last, he's breathing, but his breaths are shallow and his heart is racing.
150 heart rate now.
There's no time for mom to hold her new baby. The infant is rushed off to the NICU.
37.
I got it. He's had a lot of grunting, flaring, retracting. Got CPAP for 13 minutes.
He's taking air in, but he's not really exhaling at all.
I think we have to.
Just tube him.
Yeah, let's do it.
We're going to intubate to give surfactant.
Intubation, that means it's just like we have to put a small tube through the throat that will help them breathe.
It's a tricky procedure on a tiny patient that's less than 30 minutes old.
It sounds like it's right there. Right there.
All right.
Yeah, give him the surfactant.
Surfactant is kind of like an oil. So surfactant helps the lungs to stay open.
I felt that I didn't have any control over a situation. You just hope that everything, goes fine, and it was scary.
Carrie Bristow's been on drugs for 52 hours to induce her labor with no success. Her water broke yesterday, but she still doesn't want a C-section.
I'm hoping for another vaginal, just because it's going to be easier on the recovery for me, unless if the baby's, in distress.
She has been ruptured for over 24 hours. Her cervix really has not changed, and the further out we get, the risks increase to both her and the baby.
It's not a safe thing at this point to continue to labor.
Okay.
Because I think we've given you more than a heroic attempt. And
Yeah.
I don't know, I think it might be the position that the baby is. And you do know that the baby may not stay with us in the operating room. She may have to go to the NICU depending upon how up and down her sugars may be or how she, in terms of her breathing.
Right now, the baby's just not progressing, and I'm really scared. I feel like my body has failed me.
We need to make sure that her glucose levels are stable because we need to know if it's going to affect the baby. Sometimes when the baby's levels are too low, you can have a baby who seizes, and we don't want a baby who seizes.
Despite 2 days of trying to have a vaginal birth, it's now time for Carrie to have a C-section.
Slowly now, slowly.
No, I'm just anxious now. With her having the diabetes and the last stillborn birth, all those thoughts always race back to what happened last year.
All right, oxygen back on. And the medicine's in to help you too, okay?
Okay. Incision. All right, bladder. Pressure, pressure, pressure. Big baby, I think.
The baby's large size and position are creating problems for this delivery.
Okay, suck up. Keep going. Slowly, slowly, slowly. Slowly. What is holding us up here? Pressure, pressure, Rebecca. All right, bladder.
Doctors struggle to deliver Carrie Bristow's baby during her C-section.
Can we have a vacuum ready, please?
She and husband Tom are troubled by the memories of her last pregnancy that ended in a stillbirth.
The pressure.
Here comes the pressure. All those thoughts always race back to what happened last year. I'm just anxious now.
Pressure, pressure, pressure. Big baby, I think.
This baby's large size may be a result of Carrie's gestational diabetes, which complicates this delivery.
Keep going. Slowly, slowly, slowly. Slowly. What is holding us up here? This big, huge head. Okay.
There you go.
Thank you. Show, mommy.
There you go.
Oh, she's how big she is. She's heavy.
Baby Nevaeh is handed over to the NICU team. She weighs in at 8 pounds, 10 ounces.
You look bigger than that.
Now that she's no longer getting her mother's high blood sugars, baby Nevaeh is at risk for a seizure if her blood sugars drop.
We decided to monitor her and watch her sugars very closely.
Within a few minutes, the baby's blood sugars drop, sending her to the NICU.
Mom was on insulin drip and a dextrose infusion at delivery, and our D-stick went from 54 at birth to 34 at 30 minutes of life.
Right now, probably her insulin levels are really sky high, and then that's why it's causing the hypoglycemia.
The next hours are tense as doctors keep a close eye on the baby's sugar levels.
Baby Nickens was born last night at midnight, and he's had some respiratory distress, so he's still on the ventilator right now. We're trying to wean him off of it. He does not like that tube in his mouth at all.
The baby's father, big sister, and uncle are his first visitors.
Remember I told you, Bria?
This is my little brother.
Well, when I first walked in, I was a little worried about his health. I wanted to see my son, see his features, his nose, and what he looked like, you know.
Open your eyes. It's your sister.
It's kind of scary seeing all that stuff hooked up to him. I didn't even think that was him when I first seen him. I was like, are they sure this is my little brother?
Hi, Mommy. I love you.
So this is baby boy Nickens with issues of prematurity, RDS and respiratory failure, and an abnormal G6PD screen.
He's getting morphine. He got some at 4 a.m.
The NICU team minimizes baby Mayan's discomfort with morphine for the tube down his throat. It's connected to a machine that's breathing for him.
Okay, I just want to see if I can hear his murmur.
He's having an echocardiogram today to look at the heart, make sure that the heart is structurally normal, and also to evaluate for something called pulmonary hypertension, which can sometimes happen when babies have lung disease, that their pressures in their lungs are higher than we would expect, and it can make it harder to manage them on the ventilator. His breathing is the most difficult, and then the echo will give us some answers whether any part of the heart or lung physiology is playing in.
So far, he had a normal echo.
The baby's heart appears to be okay, but he needs additional tests to diagnose his condition. 23 hours after the birth, Candace is finally well enough to see her baby for the very first time.
I just want to see him and make sure he's okay.
Mom, how are you? You look so small.
Yeah.
Hi, baby. You're so precious.